Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Zamfara government takes vaccination campaign to tertiary institutions as part of efforts to increase vaccination coverage against the virus. President of American University Yola harps on public health education in schools to tackle COVID-19. And England extends vaccines to clinically vulnerable children aged 5 to 11 with new pediatric formulation of the Pfizer-BioNTech vaccine. Welcome everyone to the program. The recent Nigeria Center for Disease Control COVID-19 Situation Report 67 highlighted the increase in the number of COVID-19 samples reported in the 36 states and the Federal Capital Territory. And thus far, the country has tested over 4 million samples. While the report registered the decline in cases, so also the number of recoveries dropped. However, there were 21 deaths in the week 17th to the 23rd of January 2022. Of the number of over 10,000 inbound international travelers tested, 2.4%, that's 255, were positive compared to 3.1% out of over 8,000 tested in the second week of January. In week 3 of the number of outbound international travelers tested, 0.8% were positive compared to 2.7% tested the previous week. Here's more on the pandemic update.
22 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 4 states and the FCT that were dropped from the figures reported earlier. Osun accounted for the highest number of cases with 9 infections, FCT had 6, Delta 4, Rivers 2, while Kano registered 1 infection. The total confirmed cases in Nigeria now stand at 253,023. The report also includes 0 cases from Bauchi, Bayelsa, Ekiti, Kaduna, Ogun, Ondo, Plateau and Sokoto states. 317 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 229,019. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,135. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by the FCT and Ondo State. Over 14.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 5.4 million of the population have been fully vaccinated. In Africa, over 10.7 million persons have tested positive, while over 238,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 374 million, while deaths are beyond 5.6 million.
And the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, is leading the response on the COVID-19 vaccination strategy across the country at the COVID-19 Vaccination National Review meeting themed One Country, One Plan, One Team for COVID-19 Vaccination Response. He says the engagement provides a unique opportunity to review the vaccination response and align behind the plan of action. According to him, the review meeting calls for constructive conversations on the vaccination rollout and effective uptake of the vaccines. Meanwhile, in its ranking, the top 5 performing states on the COVID-19 mass vaccination campaign in Nigeria are still Nasarawa in first place, Jigawa in second, Ogun and the FCT third and fourth place, and Kwara at number 5. With over 1 million doses of COVID-19 vaccines, it says, have been administered in Kano, Nasarawa, Ogun and Oyo states, while over 2 million doses have been administered in Jigawa and Lagos states. Now, the Zamfara State's COVID-19 vaccination team is on a mission. It is targeting 2 million eligible residents for vaccination in the state, and the first port of call is tertiary institutions. According to the program manager at Zamfara State Emergency Routine Immunization Coordination Center program, Mr. Mustafa Aliyu, the vaccination campaign will be targeting 50 to 70% of its eligible population in the state. He was speaking while leading the team to Gusau College of Health Science and Technology.
Zamfara State appears to be scaling up its COVID-19 vaccination campaign as the vaccination team visits the Gusau College of Health Science and Technology to ensure the students here get vaccinated. A large number of them make their way to the designated spots in the school premises to receive their shot. They are advising eligible residents to make themselves available for the vaccine.
I'm advising everyone to come and receive this vaccination because it's good.
I feel very happy. I'm very appreciated because vaccine is the most important for those that are good citizens. The good citizens must come and collect their vaccine because to protect themselves.
The school authority is impressed with the turnout of students owing to the ongoing sensitization program.
We call on the students to take the vaccine because it is part of the government policy. And number two, we are hoping possibly the thing will not affect them in the near future because it may entail that people may not be able to be collected in the hospitals and other places. If you want to go into any other country, they will not allow you. So we are still convincing the students to take it.
The program manager in charge of the exercise says there are plans to increase vaccination coverage to include all institutions across the local government areas in the state.
Our target is to vaccinate about 50 to 70% of our target population. Our target population is about 2 million people. So far as a state, we vaccinated almost 400,000 people. So we are going steadily. And then with the drive of the NPHCD as well as the state government to ensure that we achieve what is called herd immunity in the state and in the country before the end of March, so that the country can have normalcy in terms of economic recovery from the pandemic.
So far, over 400,000 people have been vaccinated in the state. The state government promises to work to deploy more strategic approaches to reach the target population.
Well, the dominance of the Omicron variant of COVID-19 led to several countries adjusting their response. The positive note is its symptoms appear to be less severe and hospitalizations and deaths are lower than previous variants. But at the same time, its appearance has led to a surge in infections requiring millions of people to isolate themselves. Several countries have responded by reducing the isolation period for those infected, a decision that early evidence appears to justify. Professor Titus Ibekwe, public health physician, ENT surgeon, joins us from our Abuja studio for more on this. Welcome to the program.
Thank you, Millicent, for having me.
All right. I'd like to start perhaps on the global outlook. Your take on some of the countries around the world who are now lifting the ban on masking, for instance, and some others taking off all other restrictions. That's on the one hand. And then you look at Nigeria's cases that are dropping, 22 as of last night, and what you think we should be doing in terms of our response.
Yeah, thank you very much, Millicent. Well, it's said that there's no condition that is permanent. What is permanent is change. So people and society tend to adjust based on the information available to them. United Kingdom is a case study. At least they are very close to us. That have taken some measures which hitherto would have been seen to be counterproductive. Is a little U-turn to the norm of the pharmaceutical measures. We'll talk of masking, which is on top there, then physical distancing and regular cleansing. But what are they talking about now? The authorities are thinking that it is time for them to relax the issue of masking. And this is predicated on certain scientifically based information before them. One, looking at their data, their database, they realized that at least 64% of the UK population have been fully vaccinated and also had their booster doses when you talk of vaccination. At the same time, they have looked inward and felt that the pressure in the health system has relaxed to some reasonable level. And of course, the rate of infection is plateauing on a regular basis. So this put together, including some other information before them, led to their taking this decision. But again, it is not total, because we know that there are still provisos there. Unfortunately, those provisos are not being emphasized. It is still there that this is at discretion of institutions. We know that blue chip companies within the United Kingdom, like the very big shopping malls and all those, still maintain the same masking rules, and any institution that are not comfortable. And it is also advised that in any crowded place, people are still advised to use their mask. In fact, the authorities in London has come out to state clearly that if you got to use their metro, their train system, you must use your mask, And so looking at these situations holistically, it also has some scientific basis and backgrounds. We have spoken about Omicron. Could this be a blessing in disguise? And the answer, partly, we said last time, is yes. Because if you look at the features of Omicron virus compared to the previous ones, the rate of virulence here is a lot not comparable to the Delta and the very serious variants that we have in the past.
Professor
Only that the
Ibekwe,
rate of infection is very high.
Sorry to cut in, and this is just because we're approaching our break now. I also want to ask you, in terms of the virus mutations, do you think that it also affected the changes in terms of the isolation quarantine time? If you recall, it was 14 days, and now we're about 7 days.
Absolutely right. So it is also based on those scientific findings. In fact, to bring the information closer home, at the onset in 2019, 2020 in Wuhan, it used to be 3 weeks quarantine, From there, it dropped to 2 weeks. And based on scientific findings, I think there's some paper done here, a huge work that was done by Aki Oshibogo and co., including the current Lagos State Commissioner, a concerted work that they have published. So this data now show that the PCR seroconversion has dropped to 10 days, not necessarily the 2 weeks that we used to observe here. So that predicated to settling with 10 days now, still officially in Nigeria. And I know that a lot of countries are moving towards 7 days and even considering 5 days based on what they're having. So the Omicron itself, being everywhere and having mild infection, invariably is giving a lot of people what we call herd immunity. But the reality is that how long and how sustainable the herd immunity is not still quite clear. But it has it showed some good light, at the end of the tunnel, because it's like displacing the current very virulent type that we had earlier on. And over time, if mutation happen and we have even milder cases, time will come when COVID-19 will just be like ordinary flu around us. And that means that the world has won eventually. So let's watch out and see what pans out in the United Kingdom. But the caution there is that they have to do this with caution, because their immunity level cannot be compared to those of us here in Africa that have a lot of cross immunity from other types of similar infections that is around us all the time that we have had, when you compare to somebody who is in a typical setting like the United Kingdom. I don't think it's the same. So They just have to be very careful and watch
All
the
right.
situation as it plays out.
We appreciate your time always on the program. Many thanks. Professor Titus Ibekwe is a public health physician, ENT surgeon. Thank you for joining us.
Thank you, Millicent, for having me once again.
Well, still to come, UK's COVID-19 human challenge study has reached its first milestone. Find out more when we return. Welcome back. Health education in universities is necessary in tackling the challenge of the coronavirus pandemic. This was disclosed by the president of the American University of Nigeria, Yola, during the matriculation ceremony of its students in the state capital. The president notes that the consideration and proposal by the institution to apply for programs in fields of medicine and public health was spurred by the coronavirus pandemic, adding that the institution has commenced hybrid programs, which was also as a result of COVID.
We are committed this semester to applying, and we hope very much to have approval for public health, both at the undergraduate and the graduate level. It's easy to see why that's so important. We've always wanted to do public health, but the pandemic has spurred us on, because public health is about educating people to prevent diseases. At this moment, when we're still in the pandemic, maybe less severe in Nigeria, but my country and Europe and many parts of the world are still affected by this. And we always must remember we're not out of it yet. Just because Nigeria has not experienced what my country has does not mean, unfortunately, that this virus has run its course, right? Viruses work hard to survive, and they work hard with those who are unvaccinated.
And Britain is reviewing its decision to make COVID-19 vaccination mandatory for health workers in England, following concerns that an already stretched service could lose a large number of staff. The policy requiring National Health Service employees and social care workers to be fully vaccinated by the 1st of April, which was announced in November. Well, this will require all staff to receive their first shot by February the 3rd, later to meet the deadline by the 1st of April. Well, the policy has met resistance from some workers, with warnings that sacking those who did not comply could leave the NHS facing significant staff shortages. Meanwhile, the UK's COVID-19 human challenge study has reached its first milestone after administering the virus to 3 volunteers in a controlled clinical setting. The first participants recruited to the Landfall trial have now completed a period of quarantine at the Royal Free Hospital in London, and they will now continue to be monitored by the clinical team. It's a vital research to understand the course of disease in those with mild infections and to investigate the detailed natural history of the SARS-CoV-2 infection. Dr. Peter Imoesi, Research Fellow, University of Aberdeen, joins us now for more. Welcome to the program.
Thank you for having me.
All right, just briefly, before we go to the COVID-19 Human Challenge study, let's talk about what's happening in Scotland, where you are. I mean, since the First Minister confirmed the country is on a downward slope of infections, hence so many measures have been dropped. It's been 1 week so far. What do you think?
So I think when it comes to Scotland, we are actually doing very well when it comes to the rate of infections and death as well. But also one thing we've kept constant is the use of face mask. At the same time, we do abide by the non-pharmaceutical interventions when it comes to enclosed environments. And at the same time, we still have limited workforce, or we have the hybrid kind of workforce still in place at the moment. So basically, I think we are not really off the non-pharmaceutical interventions completely compared to what you have in England. So far so good. I think we're in a better place in Scotland. Then when it comes to the vaccine uptake, we do have a high rate of vaccine uptake in Scotland as well.
All right, let's come to the study. First, how often do you find someone willing to present themselves to be injected with COVID for such a science study?
I would say it's a little bit rare to have people volunteer to have themselves infected deliberately with a virus with little or quite a number of unknowns. So that's why when it comes to the level of participants, you may likely be struggling with people coming forth to get this particular trial ongoing. So I think it's a little bit complicated when it comes to the infections, because you do know some certain things. And when it comes to the other aspects, the long-term effect of this virus, no one can actually tell the implication of that actually. So people are a little bit skeptical when it comes to this kind of research actually.
What's your take on the type of research in terms of what it hopes to achieve? And I also take it that this is something that extends to the efficacy of the vaccines as well.
Yeah, so when it comes to the human challenge trial, the beauty of it when it comes to the SARS-CoV-2 is that you know the time point for which the individual is infected. Then you know the actual dose that is able to lead to systematic infections. Then you also know at what point is the individual able to clear up the virus. And at the same time, you're able to determine the actual immunity and the duration of that particular immunity over time. Then also, you can also tell to what extent do you need to expose this individual to lead to mild, moderate, severe infections. And based on all of these parameters, you could tell effectively if this individual are able to produce the required antibody you're looking for. Then subsequently, after that first infection, you could invite this individual back for the second exposure to see if they are able to release the required immunity against the reinfections you have. Then also, when it comes to that, you can tell specifically which part of the virus region do you have this particular antibody targeting. For instance, when it comes to the vaccines, we know that the vaccines are actually targeting the S1 and the S2 region of the spike protein. Whereas when you do this kind of trial, you can clearly see if the natural infection is targeting other region of the virus, and which of this region gives a potential neutralizing effect when it comes to the overall immunity itself. So basically, when it comes to the human challenge trial, you can monitor all of these parameters to give you a fair understanding the way the virus behave and the way the immune respond over time. Then when it comes to the vaccines, finally, is that if you vaccinate people again, then you expose them to the virus. You can tell the way the vaccine and the immunity induced from the vaccine, you can tell the way it behaves to the virus itself. Now, based on all of these parameters, you can then go on to develop a very efficacious vaccines in the next generation of vaccines, actually.
And in terms of the timeline, when do we expect perhaps the final results of the study?
I think the first one had to do with about, 12 months, thereabout. So it depends on the duration of the second phase and what they intend to do. So the first phase is completed with the Imperial College study. So now they will go on to the second phase, and based on those particular data, we can tell the outcome. For now, they are holding on to the first phase of the trial because they are trying to ensure that these particular data are not kind of compromised over time. So basically, maybe this time next year, or maybe at the end of this year, we can tell exactly where we are with this particular data and the trial itself.
Indeed, and we also understand the team is preserving volunteers' anonymity with good reason. Thank you so much, Dr. Peter Moesi, Research Fellow, University of Aberdeen. Thanks for joining us.
Thank you for having me.
Well, staying in the United Kingdom, the much-awaited report into parties at Downing Street has finally been released, saying there were failures of leadership and judgment in Number 10 and the Cabinet Office. The 12-page report also makes clear that some of the events in Downing Street over the lockdown should not have been allowed to take place, while others should not have been allowed to develop as they did. It says Number 10 was used for gatherings without clear authorization or oversight, and that was not appropriate. Well, let's bring you a bit more of the global update.
But first, hundreds of anti-vaccine protesters blocked the streets of Canada's capital on Sunday, a day after thousands descended on the city, Ottawa, to protest against Prime Minister Justin Trudeau and COVID-19 vaccine mandates. Canada had imposed the mandate for the trucking industry 2 weeks ago. Under it, unvaccinated Canadian truckers re-entering the country from the U.S. must get tested for coronavirus and quarantine themselves. The weekend demonstration against that has shifted into one against the Trudeau government with a strong anti-vaccination streak.
Shall we go into the little room?
Sure.
Meanwhile, Britain is set to begin COVID-19 vaccinations for clinically vulnerable children aged 5 to 11 with the new pediatric formulation of the Pfizer-BioNTech vaccine. 11-year-old Xavier Aquilina, who has epilepsy and lives with vulnerable family members, was one of the first children to get the vaccine on Saturday, January 29th, ahead of the formal rollout.
It was more of like a kind of surprise pain, not hurting that much, but just giving you a small jump scare. It's not as stressful as you may think. Everybody here is quite nice, and you get a sticker at the end.
Yippee that do. You can visit our website, channelstv.com, for more updates and also a better understanding of the pandemic. You can find other stories there, all at your fingertips. So that's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.